Hi there, this is Dean Karampolis and welcome to The Good Doc. During my last chat with you, we discussed about COVID and its implications in your practice and how to deal with it. As you all know, with the latest spike that we've had quite a number of COVID patients, and we have experienced this quite a bit in our hospital, and an extraordinary number of deaths. This naturally causes the healthcare provider to think that they're doing something wrong or that they're failing. So I thought it was appropriate to talk about this next topic, which is called dealing with failure in your practice. This started out to be a good day at work. In fact, you've been on a roll lately. You have made some challenging diagnoses, you've been nailing procedures, your patients are doing well, people at work admire you. In fact, you're feeling pretty good about yourself. But today, out of the blue, near the end of your shift at the hospital, one of your patients suddenly goes bad, codes, and dies after a very long resuscitation time. After talking to the family and completing the usual paperwork, you finish your shift and then you begin the long ride home. On your way home, a wave of panic hits you like a brick. My patient had a pulmonary embolus and it never entered my mind. Fearful thoughts encircle your brain in an endless feedback loop. You ruminate over the case, remembering multiple times in the hospital course where you should have known that he had a PE. You're flooded with guilt because you knew the family and the patient very well. Your patient had very small children. You feel worthless and afraid. You're concerned about a lawsuit and the effect this will have on your career. You are afraid that your peers and nurses will think less of you. Finally, however, you're able to suppress some of these thoughts and collapse into bed, experiencing a fitful sleep, only to start your next shift in the morning. Failure is an inevitable part of life, especially in the healthcare field. It is especially troubling for us because so much is at stake, a patient's very life. Similar thinking, errors or omissions in many other fields result in trivial outcomes. For example, when you order at a fast food restaurant and your order gets messed up, you may be angry and lament that you paid for fries and did not get them. But when we make similar cognitive errors at work, patients actually die. Also, I cannot think of another profession where a worker is held to such a high standard. And the problem is compounded by the fact that we often set impossible standards upon ourselves because we are high achievers. Failure in the medical profession is hard to define and somewhat subjective. The best definition that I can come up with is this: failure is seriously falling short of your reasonable and realistic expectations. Built into this definition are several important concepts. The failures we will be talking about are serious and significant. For example, the failures we're talking about today would not include simply forgetting to co-sign an order before you go home, or not remembering to put in your hospital charges on a patient before you leave work. The second part of my definition encompasses the notion that an error from a seasoned physician may constitute a failure, but the same error from a nurse, RT, or resident less experienced may not. By the way, just a sidelight here, I'm not going to be talking about the medical legal concepts regarding standard of care, which have different definitions than I'm bringing up today and have different implications. I will address medical legal concepts in a future talk. Finally, according to my definition, failure can be actually judged by your own standards provided they are realistic and reasonable. For example, many of us think that we have failed because we did not live up to our standards, but in fact our standards are unrealistically high and perhaps impossible to attain. Notice that in my definition, patient outcomes are not part of it. Outcomes alone are not frequently a good measure of failure. This is especially evident in the COVID-19 epidemic, which we're facing right now, where we're doing all the right things and our patients are dying at an alarming rate. Of course, off-the-chart mortality rates attributed to a provider can raise concerns that the provider is failing in the extreme example. It's also important to understand that failures often have different root causes that have different implications. Let's take the hypothetical of endotracheal intubation. Let's say we have an intensivist who's performed hundreds and hundreds of intubations. Rarely, but every now and then, He encounters a patient in distress that he can't intubate. Is this a failure? Technically, you might say yes, although he has tried to the best of his ability. But let's take the same scenario where he's obviously not able to intubate the patient after multiple attempts, and pride gets in the way of allowing another person to try. Or let's say he's overestimating his ability, or did not appreciate the difficulty of the airway and failed to call anesthesia to intubate or to be on standby. These represent more serious failings and perhaps moral failures. Let's go back to the pulmonary embolus example that I just gave. There's a difference between simply forgetting to consider the diagnosis and being too lazy to thoroughly review the chart that day that showed a positive lower extremity ultrasound. So, what do we do if we think we've screwed up? First of all, don't panic. Now, I know this is easy to say. If you find yourself panicking to such an extent that it's really interfering with your mental ability or your ability to even function, it's important to talk to somebody as soon as possible, such as a close friend or relative. But there's a better thing that you can do, and most of us don't do this. Before an incident like this occurs, you might want to decide to cultivate a relationship with a person that you know who is wise, honest, and is willing to mentor you or to offer advice. It's preferable to find the person that works with you, because the bulk of the discussion will center upon whether you actually did something wrong. This person should be able to tell you if you have set unrealistic expectations upon yourselves. Many times we have actually done nothing wrong, but he or she should be honest with you and be willing to tell you what you did wrong and what to do to prevent a similar occurrence. If you conclude that you have done something seriously wrong that resulted in adverse consequences, be sure to report this to risk management and obey their instructions on how to proceed. And now, the hard part. If you have truly screwed up, do not wallow in self-pity. Do not just block it out or blame somebody else. Find a way to take stock of your shortcomings and develop an action plan to correct them. Use your mentor to make you accountable for changes you make, and by all means learn from your mistakes. Realize that you'll continue to have failures and are far from perfect. Also pray. If you're interested in that aspect, visit my membership site under Medicine as a Ministry for insight into the role of God in our practice. After you have done this, stop obsessing, press on, and keep working. There's a sports analogy that talks about three-point shooters and the great basketball players who miss, that what they're supposed to do is just go ahead and keep on taking the three-point shots. Very similar in medicine. Now, if you've been through this, be sure to have empathy for others who are dealing with failure and be willing to help them. Above all, be humble. Let me share an experience I had in the mid-'80s. I had just finished my pulmonary and critical care fellowship. I was very young and wanted to make a good impression. A very well-respected, politically connected, seasoned internist consulted me to do a fiber optic bronchoscopy on one of his patients who was having hemoptysis. During the bronchoscopy, I visualized a clot near the right lower lobe. I very carefully suctioned around it, and immediately the patient started exsanguinating. She was difficult for me to intubate because of the torrential flow of blood, but I finally got the airway in. Shortly after that, she coded and died. Of course, I explained all of this to the internist and to the family. I had never previously had a bronchoscopic complication after hundreds of bronchoscopies in training. Thoughts started spinning in my mind. Did I do anything wrong? I ruminated over the details of the procedure. I was afraid I would lose the respect of my consultant and my colleagues. In short, I actually felt like quitting. I discussed this with the pulmonologists in my group, and they were very understanding. I prayed a lot. But I decided to go on with my next bronchoscopy days later. And nothing like that has ever happened again, but it totally changed my perspective when I do bronchoscopies, even to this day. I realize how easily things can go wrong. We are all familiar with healthcare providers who are arrogant, prideful, and full of themselves. It is difficult for me to understand why they are that way. The practice of medicine is self-humbling. Just when you think you are above it all, something bad happens that reminds you that you are human and fallible. Those that seem oblivious to all this are either in self-denial, they lack insight, or have a very strong defense mechanism. Those people become hardened and unchanged. The mature provider, on the other hand, acknowledges the mistake, analyzes the sequence of events, then learns something that can be applied to the future. The person who does this is well on his way to being the good doc. Those who are unwilling or unable to do this become stagnant and trapped in mediocrity. In my opinion, true failure is when you fail to face the truth or to learn from your mistakes. True failure is when you give up and quit. I look forward to any comments you might have. And please subscribe if you find these talks helpful. And I encourage you to explore my website. It is currently under construction. Thank you very much. I look forward to meeting with you again. Have a good day.